Hi, I'm Jennifer Schneiderman, and I'm one of the stem cell transplant physicians at Lurie Children's.
Hi, I'm Rachel Bercovitz, and I'm one of the benign hematologists at Lurie Children's. So, like all other Hem/Onc fellowships across the country, we're a 3-year program. The first year is an intense clinical year, with the second and third years being devoted to research.
So we want to give our fellows the opportunity to be exposed to all of the tenets that make up the Hem/Onc realm. So even if you don't know what you want to do within hematology oncology, when you start this fellowship, you'll be so well exposed to oncology, neuro-oncology, stem cell transplant, benign heme, that you really will have every opportunity open to you.
We actually get a wide variety of patients because our catchment area is so large, including both the Chicagoland area and throughout Illinois and southern Wisconsin. The benefits of having such a diverse patient population means that our fellows are going to see a wide variety of patients, including the bread and butter type things like iron deficiency anemia and standard risk ALL, as well as the very rare conditions such as multifocal Castleman's disease and Glanzmann's thrombocythemia.
One of the other big benefits of training here at Lurie Children's is that our faculty across all of those disciplines are world-renowned and have a lot of experiences open to the fellows, a lot of mentoring that's available to them, and should provide the fellows with connections necessary to further your career, whatever that ends up being. So the benefits for being downtown here in Chicago on the Northwestern campus are actually really broad for hematology oncology fellows specifically. One, because we have easy access to the Northwestern Lurie Cancer Center, so we can participate in meetings with the adult oncologists, the adult transplant physicians, the adult hematologists. It makes the research opportunities a little bit easier. Our fellows enjoy a very in-depth research experience if they choose to go into a lab. Alternatively, fellows can do clinical research alongside with some of the faculty in our division or outside the division even. Fellows that are interested in doing clinical research can also complete a master's degree through Northwestern University.
You can tell that the faculty really enjoy their job, which obviously includes both the patient care part as well as the teaching fellows part. And our fellows are also just a great group of people. We hang out socially sometimes, and I just really enjoy the people that I get to work with.
We also have tremendous support from our division head, Dr. Stuart Goldman. He's very much a proponent of our fellowship always being successful. And then another faculty member, Dr. Orrin Becker, who does predominantly lab work. He helps us with the basic science portion of the 2 years of fellowship and helping fellows find labs. So really, I think it's just a tremendous group effort, and none of us could do it alone. And we just really try to bring our best pieces of ourselves to the table so that we can provide a really great service for our fellows.
I just love Chicago as a city. It's the only city that knows how to do both hot dogs and pizza correctly. Other things I love about Chicago include the museums, the ability to go to Broadway musicals and plays, and just all of the sort of cultural opportunities.
So I think the sports provide some great entertainment for people here. Restaurants, of course, are fantastic. And then during the months of March through October, I would say all of the outdoors activities.
The architecture, honestly, that's one of my favorite parts about being down here in Streeterville, is just getting to appreciate the skyscrapers and the Chicago skyline that you can see if you just walk a few blocks east to the lake.
New fellows, we love energetic, excited people who have open minds, who are able to just come and work really hard, but really enjoy being in the position that they're in, to be able to be privileged really to take care of these patients.
What we're looking for in a fellow is somebody who honestly loves Hem/Onc, stem cell transplant, or neuro-oncology just as much as we do. One of the pieces of advice that I got after finishing residency was to make myself a really good pediatrician and to be a good pediatrician. And that becoming a good hematologist or oncologist would come with my fellowship training. So what we're looking for are good pediatricians, and we will turn you into good hematologists, oncologists, or transplanters.